Here we have the case of infective endocarditis, which is defined as inflammation of the endocardium, and it typically refers to the infection of the valve surfaces with the formation of vegetation. So the vegetation is in this part of the picture, and the valve can be seen in this part of the picture. On higher magnification, we can see that the vegetation is formed by the fibrin and platelets. And here we can see multiple violet foci, and those represent bacterial colonies. In this part, we can see the valve that consists of hypocellular fibrous tissue. And in some parts of the valve, we can see acute inflammation represented by neutrophils, by multiple neutrophils. Aggressive cases of infective endocarditis can sometimes cause the formation of abscesses. We can also see necrosis of the valve. And over the time, the vegetation can be organized by granulation tissue, and sometimes, especially after longer aggressive antibiotic therapy, the bacterial colonies are no longer visible. The differentiation of infective endocarditis into acute and subacute types is clinically no longer recommended because these two categories are not that separate as they originally thought to be. However, we can still talk about more aggressive cases with perforation of the valve, usually associated with Staphylococcus aureus infection, and we can also see less aggressive subtypes where the vegetation is organized by granulation tissue. So let's talk about pathophysiology for a while. The first step in pathophysiology of infective endocarditis is the endothelial damage that leads to deposition of platelet and fibrin thrombi. And these thrombi can be subsequently colonized by circulating bacteria, and they form infected vegetation. Bacteremia can result from poor dental hygiene, from invasive procedures, or from indwelling of venous catheters. Intravenous drug abuse is another example of a risk factor for infective endocarditis. Part of the vegetation can cause septic embolism, and it can create the infarctions in the brain, in the spleen, in the kidney, and liver. Clinically, we can also see splinter hemorrhages under the fingernails, and so on. So this was a brief description of infective endocarditis. Thanks for watching.